Hi, Serena.
Good morning, Dr. Shaw. How are you?
I'm good, sweetie. I'm good.
Good.
So I know you were here last year, and again, we're going to do a full body exam on you.
Okay.
So what I usually do is I start in your scalp, and I'll work all the way down, and I'll ask you questions as I go along, okay?
Sounds good.
Do you have any questions?
No.
Okay. Is there anything on you that you're worried about today?
No, not today.
Okay, good. All right. So, you know, I always look in the scalp because just like on the body, you have freckles and moles, and I'm always looking to make sure that you don't have any. By any chance, are you a hat person?
No, not really.
Okay, and I only ask that question because, you know, in the summer I worry about the sun hitting your head and causing sunburn in parts. So I always talk about now they have SPF-proof hats, and you can get them, you know, online, or you can get them at REI or Dick's, but the fabric is a much tighter weave, so it allows you to get another level of protection.
Okay.
The other thing you can do is they now have sunblocks in the form of sprays, so you can actually spray your scalp, and that'll give you another level of protection.
Okay.
Okay? Now, so you have a couple of little freckles on your arm, and you have a little bit of dyspigmentation, which these little light spots, nothing that I want you to concern yourself with, absolutely normal. Are you using sunblock right now?
I do.
Okay, great, because, you know, sometimes the biggest lie that's been told is the darker your skin, you don't need sunblock, and that's false. Now, do you go and have your eyes examined at all by
I do.
an ophthalmologist?
I do.
You're good. And, you know, I always say that because I always worry about freckles and moles in the eye. Although it's rare, ocular melanoma exists, so that's something that I can't do, even though you're here for a full body. It's really important that you go and get your eyes checked.
Okay.
And at the same time, bring your sunglasses, because I always like them to look at your sunglasses, and I want to make sure that they cover you for UVA, UVB, and they're polarized. Okay, even though your eyes are dark, I always worry because I can't recommend a sunblock for your eye because it doesn't exist, all right?
Okay.
Good. And your dentist, did they do an oral cancer screening in your
do.
mouth? They pull out your tongue, they feel
Yes.
your glands? Good. So that's the other thing. Now, do you go yearly for your GYN exam?
I do.
Good. And you have a mammogram?
Mhm.
Okay. And any females in your family have ever had any breast cancer, ovarian, or uterine cancer?
Breast cancer. My
Okay.
mother.
Good. And has anybody else in your female family, no ovarian?
No.
Okay, good. All right. So that's just something else I want to make sure. And anybody in your family with colon cancer?
No.
Okay, good. So at the age of 50, that's when we usually have you go for a colon screening. All right, so that's
Okay.
important. All right. I'm going to take a look at your back.
Okay.
Again, you know, I always look for those freckles and moles. You know, and the only thing I see of what I call the normal ABCs of sun damage on your back, you know, you have these little freckles and moles, some of these little cherry angiomas, but, you know, nothing that I really see back there I'm worried about. Does your primary care physician ever draw any vitamin D levels on you?
No.
He doesn't, okay. So it's just something as a dermatologist I'm really sensitive to. So I highly recommend that next time you go to your primary care physician, ask to get a vitamin D level drawn. You know, 30 to 100 is what we consider normal, and most of us are below 30, and lots of times, especially for women that are perimenopausal, menopausal, I always like your levels to be a little bit more elevated. So some people need about 5,000 IUs of D3 a day, but not everybody, so that's why I always like you to check, all right? You know, I can't adequately look under your nail polish, so when you get your nail polish taken off, always look under your nails and make sure there's no dark spots, and if there are and you're concerned, just come in and let me take a look, because
Okay.
I can't adequately take care of that. Okay?
Okay.
Even on your feet, and what I would suggest is when you get your nail polish taken off that you look underneath your, you know, fingernails and toenails and make sure you don't have any dark spots. I'm looking between your toes. We can get moles any place on our body, and this is a place, although it's rare, people do get freckles and moles, but everything looks good. And, you know, lastly, you know, I just want to make sure when you go to your GYN, you know, they look at, you know, your vaginal area and make sure there's no freckles and moles, and if anything is atypical looking to them, you should come to me and we'll do a biopsy of that. Okay? Any
good.
other concerns for you today?
Not today.
Okay. All right.
Everything's good.
Thanks,
Thank you.
Serena. Appreciate it.